Today, 9/11 memorials for the fallen were held in New York, at the Pentagon, and in Pennsylvania. On that day, 343 New York firefighters died. 409 more have died from health complications linked to working in the toxic debris. The World Trade Center Health Program was created to get first responders and other survivors treatment, but funding and staffing cuts have hampered progress. For tonight's interview, we are joined by Dr. Stephen Markowitz, a member of the board which advises the WTC Health Program. Doctor, thank you for being here.
Sure, thanks for having me.
Help us understand the effect on 9/11 victims now 24 years after.
Well, this is the World Trade Center Health Program has 145,000 people, both responders and survivors, who were there or worked there or lived there over the ensuing number of months. They're enrolled in a program which monitors their health and provides care for them, treats their medical conditions that were related to 9/11, but also monitors their health to either early detect new conditions or provide some level of reassurance.
What are the kinds of illnesses, the risks? Well, first, let's do the illnesses.
Sure. Well, actually, cancer is the single largest category now. The other conditions which are well known are the respiratory problems, the sinusitis, the asthma, problems like that, and mental health conditions like PTSD, depression, anxiety, and the like. But what's really coming out now is cancer. There are almost 50,000 cases of people with cancer in the World Trade Center Health Program. And if you go back 5 years, John, it was half that. So it's really growing very quickly and much more quickly than the other conditions.
Since you know it's coming or can look for it, how does that help relative to, say, a person in the regular population where you're not looking exactly for it the way you would be this group?
Sure. Well, this is a program that gets very close annual monitoring, meaning that the doctors can look very closely for a number of illnesses, including early detection of cancer, whether it be thyroid cancer, lung cancer, colon cancer, breast cancer, and the like. The thing about this growth in cancers is that it's diverse. There are many different forms of cancer. And it's happening in part because the population is aging.
Sure.
Back at 9/11, the average age was about 36 or so of the workers. Mm-hmm. Now it's 60, 62. Population's aging and they get cancer. But there's another thing we're really worried about, which is the delay in time between the exposures that occurred 24 years ago and now when the cancers would be expected to come out. We know that in toxins, the way that they work with chronic illness is not only do some of them produce immediate problems like we saw in the lungs, but after 2 decades or more, they produce cancers. It's called latency. We know that that's true for many settings, asbestos, silica, and the like. Well, we're now well into that latency period. So now we're in that period of risk. I'm not saying people are at risk,
right,
but now's the time we're really worried about cancer and other chronic conditions.
There have been cuts at HHS. How has that affected the World Trade Center Health Program?
In a number of ways. One is the program has grown. There have been 10,000 people who added to the program last year, and this year 5,000. So the demand, the administrative demand on the program is very large, and they have fewer employees in the World Trade Center Health Program than they did in January of this year because of the cuts. Those need to be restored and, in fact, need to be expanded. But here are the things that I think that we're really missing. One is that people in this group who are being monitored, some of them develop autoimmune conditions. Some of them develop heart disease at a young age. And they wonder, was this due to my 9/11 experience? I didn't have a family history. Is this due to 9/11? They should have answers to those questions. And the way those questions are posed to the health program is through a petition process. And there are active petitions on autoimmune diseases and on heart diseases. Are they related to 9/11? And people should get answers to that. And we are not getting answers. And I think part of that is that the program needs to be funded more properly, have access to proper personnel so that they can give us answers to that.
Dr. Stephen Markowitz, thank you so much for being with us.
Thank you for having me.